Hi, I'm Stefanie Fritz. I am a makeup artist in Sonoma County, Napa County. I am a beauty content creator. I love Dr. Mabrie. I think he's the best. I was able to ask all my community on social media to tell me all their questions about Botox, filler, fears, procedure tips, and he has been so willing to answer all their questions.
I'm really excited to do it.
Me too. To start off, what do you think the biggest difference is between Dysport, Botox, Xeomin? What's your preference?
So what are the difference between some of the neuromodulators? Botox is the original one. It's like the difference between Coke and Diet Pepsi. The active ingredient is the same, it's just how else are they packaged. So for example, Dysport tends to spread a little more. If you put it in an area like this, it's going to cover a larger area, where Botox is a little more precise. Some people have found that maybe Dysport kicks in a little sooner.
So if you had a special event, you may want to
maybe
get on
Dysport,
it.
maybe
Okay.
Dysport.
Okay.
But in general, they're all very similar. I would say the one advantage, if you started to not be as sensitive to Botox, then maybe you might try one of the other neuromodulators, like Xeomin, Jowls, or Daxxify. But essentially, they're all very similar.
So Daxxify, I'm curious to hear your thoughts on, because Daxxify is the one that allegedly lasts twice as long, kind of costs twice as much from what I hear. Do you think it's worth it?
Here's the real deal. We did our own internal experiment with our office, and we tried half Botox and half Daxxify. We didn't find that it lasted much longer. So I'll say that I think the main advantage of Daxxify is, again, if you're trying Botox and it's not lasting, maybe you might try the Daxxify as an alternative. But I can't say that we found that it lasts twice as long.
Is it twice as much?
It's usually going to be about 20% more expensive than
Well,
Botox. Yeah.
That's bad. Okay.
So I think they're lasting a similar amount. You might try Daxxify if your Botox isn't working anymore.
Do you have a preference amongst all these things? Like if you could choose, or do you really feel like it's patient specific?
Half and half. I'll let my patients, if someone says, hey, I really like Dysport, we can do it. But I do tend to use Botox a little more.
I've liked Botox the best too. I classified some of your questions into fears, because I know I had a lot of them myself. So let's go. Are you ready?
Let's do it.
Okay. Will filler cause issues if you have a facelift later on?
The short answer is not usually, especially if you're using hyaluronic acid fillers like Restylane or Juvederm, and using those in the under eyes, mid-face, cheeks. There should not be a problem with facelifts later.
Okay.
There is one type of injectable material, Sculptra, which is more of a biostimulatory filler, and that means that it builds your own collagen, and you're using it in these areas. And most facelift surgeons say that they are concerned when there's Sculptra. It makes the dissection a little more difficult. If you think you're going to get a facelift in a year or two, maybe not use Sculptra in these areas.
Good tip. I am so nervous about under eye filler. What are the contraindications to getting it? I know I was really paranoid myself. So you've heard this before.
We were, right?
Yeah.
If you just open the Yellow Pages, and if anyone knows what Yellow Pages
Or the
are.
Groupon.
Yeah, okay. Oh, definitely Groupons.
Yeah, no Groupons, people. No Groupons.
Is just finding someone that's not going to use a lot of filler right under the eyes. Sometimes when there's this concave area, that there's going to be the shadow up here. But the problem is actually not the under eye, it's the cheek. And so your provider needs to know how to fill the cheek out and a little bit in the under eye so that it's going to look natural and that it's not going to be puffy.
I thought if I was going to get under eye filler, he's going to be like shooting up this whole area. And I'm like, it's so close to my eyes, that's terrifying. But actually, it was more in this neck of the woods, which I actually think just feels better.
Yeah.
What happens to your face if you stop doing Botox and fillers after decades of use?
I've been doing fillers for over 15 years, and I have a lot of patients that I've seen for more than 10 years. There hasn't been a problem long term. Some of the results actually will last 5, 6, 7, 8 years if you stop. The good thing is that your skin does not stretch, and then you need more. That's not, hasn't been the case.
So you don't look like a deflated catcher's mitt.
Yeah,
Okay.
you don't. If anything, the fillers are there, and you tend to need less filler over time because it's just supporting, and there is some new collagen growth. So what you'll find is you're going to use a lot less filler over time. And if you ever need to dissolve the filler, if you're using hyaluronic acid, you can always dissolve it.
That was one of the things that was really appealing to me about Dr. Mabrie, is that some of these patients, when you see them 10 years later, they look better than year one. I was here for that. We're here for that.
Oh, awesome.
Okay. Can you do Botox while breastfeeding?
We usually recommend that they ask that to their pediatrician, and I've heard mixed results. Some pediatricians have said, hey, it's not a problem, and some pediatricians have been more cautious. So I would have to say we always follow advice of the patient's pediatrician.
Solid. Can you have an allergic reaction to Botox, and what happens if you do?
If you're putting the Botox in, maybe your needle hits a nerve, that can leave you with a headache for a few days. That's rare, but that can happen. The other thing is that sometimes Botox, it paralyzes muscles, and you're trying to paralyze very specific muscles. If it spreads to the wrong muscle, you can get a droopy eyelid or a droopy eyebrow, unfortunately. That's interesting. Sometimes it makes the music come on.
What happens if that happens?
Okay. Fortunately, that's very rare, less than 1% of the time. Okay. If it's a droopy eyelid, you can use some eye drops that will help stimulate the eye. So fortunately, that's very rare.
We like very rare.
And allergic reactions is going to be even rarer. So that's something I don't think we have to worry about.
Okay, great. Does having an autoimmune disorder make it unlikely for hyaluronic acid fillers?
Okay,
we're really putting you to the test today.
These are some tough ones. I have not seen that be a problem either. We have a few patients that have autoimmune disorders. Again, we're usually talking with their physician that's managing them to make sure that they're cleared for that. Sometimes we'll do a filler in the forearm as a little skin test to make sure they're not reacting to it, but I have not seen that be a problem.
Love it. What is the downtime on lips and filler?
With the lips, we used to get a lot of bruising. Occasionally we do, but now we're using a smaller needle, so I think our bruising is a little less.
My experience was my very first round, I did bruise, but it was within my lip line, so I felt like I could use lip liner really easily to cover it. I didn't struggle to cover it. The second time, I don't know if maybe I was a little bit more used to it, when we did our touch-up, I had no bruising. My experience hasn't been that it's been difficult to cover if you do get it. Something that someone told me was you're gonna get hooked on that feeling of how your lips look right after because they're swollen, which I thought they were crazy. I thought I looked like a duckbill platypus. Now I look at those photos, I'm like, how do we get back there? So I see how we started. Do you have any advice for people who do bruise easily, whether it's Botox or fillers, things that they can do to maybe prevent that?
Definitely trying to avoid anti-inflammatories like aspirin, Advil, Motrin. You can still take Tylenol. We don't get as much bruising under the eyes. When we're doing the under eyes, we're kind of just sneaking in and just placing some filler very gently. When we're doing the jawline, unfortunately, we are using the cannula to kind of make a space.
Right.
So we do get more bruising with the jawline. So we tell patients to prepare for that.
Okay.
I'd love to ask you some questions about makeup for bruising with the lips and stuff.
Yes, so I thought for sure I was gonna be a hot mess after a filler, and you shocked me. The only bruise I had on my entire face was just a tiny bit on my lips. I mean, I'm the person who's gonna get like the injection bruises. I've had a couple shiners, none, killed it.
Nice.
Okay, so last fear, does filler cause scar tissue?
I have not seen filler to cause scar tissue. I would say hyaluronic acid fillers like Restylane and Juvederm do not cause scar tissue. Some fillers or injectables like Sculptra, you put it in and it's stimulating your own collagen production, which is a lot like scar tissue.
Okay.
And so with Sculptra, that's why you have to be careful for future facelifts.
Gotcha.
So I had some questions for you about aftercare with makeup.
The best way if you have a little bit of bruising after filler on your lips, which I definitely had, is I think I would have a good lip liner on deck. I'm a big fan of Anastasia Beverly Hills, MAC. I would be prepared with something that's maybe 2 shades darker than your natural lip. Give it a little bit of shading, it'll help. You know, you can even use clear balm or something on top.
So lip liners and a couple shades darker than your nose. Okay, great. What about bruising, if you had some bruising here?
Bruising on your face can definitely get a little bit tricky. I do think that a color corrector can be helpful, but if you're kind of a beginner to makeup, that can also be a hot mess. So using a color corrector that has like a pretty good range, Bobbi Brown corrector, they've got some good pink undertones, which I like, especially if you get bruising under your eyes. I think peach works well if you have a little bit of a darker skin tone. I think it's just a little bit more user-friendly than like, okay, my bruise is purple, so I'm gonna use yellow, like you're gonna look crazy. So I do a little bit of a color corrector, set it with a little bit of powder and a pressing motion so it stays put and you should be good to go.
Okay. I want to ask you about the effects of using fillers for the under eyes and your makeup routine. How has it changed?
You know why he wants to ask me this? Because he knows he likes the answer to this one. And truthfully, you're gonna be using a lot less concealer. You're gonna be using less coverage on the daily. Your makeup routine's a lot faster because you're not spending this eternity trying to color correct all kinds of.
I love that.
The one that came up a lot was advice for finding a good doctor in my area. What do you feel like the criteria is for somebody who may not live around here? I know lots of people fly in to see you, but pretend they're not gonna do that.
Okay. Fillers are a lot more provider dependent. You know, the Botox, you're just putting it in and that does the work. But the filler, you have to know where to treat, how much to put, at what level to put, and how much to put at a time. So you do want to find someone who they do fillers a lot. You know, some people are doing
a little bit of everything.
A little bit of
like
everything.
A specialist.
Yeah, it's nice to find someone that specializes in it. I think it's helpful to look at their photo gallery and see, do they have people that look like you? Looking at their staff, does the staff still look natural? Trying to get a feel for, is this an area that they do a lot? If you're getting your fillers done somewhere and they don't take photos before, to me, that's a little bit of a orange flag. So to me, that's always a little bit concerning. For us, we spend a lot of time taking standardized photos and we want to compare. And anytime we see a patient, even if it's 10 years later, we always put that original photo up just to make sure, hey, how do you look compared to 5 years ago or 6 years ago? Let's not lose our way.
I love that because you also don't want to get 10 years down the road and not look like yourself.
Yeah, exactly.
What is the best for vertical lip lines for filler? Is it in the lips? Is it around them? So as we're out there sucking on our Stanleys, giving ourselves vertical lip lines, what are we doing about it?
If the lips are really deflated, that's the first thing, is because when the lips get smaller in the center, everything is shrinking down like a grape to a raisin type of thing. So you want to put some filler back in the lip first of all. The second thing is you're losing fat in the white part of the lip, so you want to put a very thin layer of filler there to help get rid of those wrinkles. And then the last thing you want to do is maybe a little bit of Botox to relax this. There's a muscle that makes you do this. So if you can relax that muscle, then those wrinkles won't come as much. So you're doing fillers here, a little filler here, and a little Botox. And I think it's important to do it in like steps, at least 2 steps.
Best treatment for deep 11s. I'm assuming real deep, where she's a little nervous that maybe Botox might get after. Do you think it's Botox? Do you think it's filler? Is it both?
The number one treatment for that is going to be a neuromodulator like Botox, because the 11s happen from these muscles coming in like that. Now, sometimes these 11s have been etched in from years of worrying, right?
Furrowing at your kids.
Yeah. In those cases, you do want to add a little bit of filler, but you want to go to someone who does that a lot, because you're close to your eyes here. And that's an area where you want to be careful that the filler doesn't spread to the eyes and cause issues with filling.
Intense wrinkles under the eye when smiling. Should it be treated with Botox or filler?
Okay, the bad news first. Okay, fillers are better at shadows under the eyes. Okay, for a depression, and they're great at that. Fillers are not great at the wrinkles under the eyes. But the good news is that it's actually the shadows that are more the issue than the wrinkles.
Agreed.
We look at the wrinkles and we think that's the problem, but even like 11-year-olds, when they smile, they have wrinkles. So you have to wrinkle when you smile, but when you put the fillers, it will make you look better by getting rid of your dark shadows. It may make the wrinkles look better, but we can't promise that. Sometimes the wrinkles look better after fillers, sometimes they don't, but you always look at least better.
Nice. And then where does Botox play a role?
There is a time where if someone smiles and they get what we call like a jelly roll, where there's a muscle that kind of bulges like this, and Botox can do 2 things. It can relax that jelly roll. It can also make your eyes bigger when you smile.
What are the contraindications of that? That sounds terrifying.
Let's say you have bags under your eyes and you put Botox there, it can make the eyes hang down and be worse. So you have to
Wrinkles are fantastic. It shows that you have some expression and you've laughed a lot.
There you go.
Okay. Can you get Botox just between your eyebrows, or will it look weird to not get Botox all over?
No, you can absolutely get Botox just between the eyebrows. This is like the home run area. The first thing it does is it gets rid of the wrinkles, but it also makes you look a little more relaxed and chill.
Like that.
Sometimes when you have wrinkles in the forehead, you can get rid of those, and that can be nice, but it can also make your brows come down. So we don't always recommend that. But Botox only between the eyebrows could be totally fine.
Got it. Is there anything that we can do for jowls besides mid-face filler if one were nervous about it? Jowling being like this bulging down.
Yeah, so we call these the marionette lines, where you look like a puppet.
Okay.
And they're kind of the front of the jowl. The jowl kind of comes here.
Okay.
Right, so early marionette lines turn into jowls.
Okay.
And so one is a little bit of treatment here, some filler in front of those.
Okay.
Second, sometimes it happens because your chin is good. I'm making myself very vulnerable to you. I'm going to show you guys this.
Okay.
Going like this doesn't look good. So what you want to do is bring the chin out, and that kind of like brings us in, and that will support that. So putting some filler back in the jawline, because our jaws get smaller as we get older. And that's one of the reasons we get the marionette lines and the jowling. So we'll put some filler here. Sometimes a little bit of Botox can help with the muscle there. But it's mostly fillers here and fillers here.
So if you were trying to get away from filler, it doesn't sound like you can, but it's not mid-face, if that was.
Yeah. So number one would be fillers down here, and it looks really good for that.
I'm sure you have a perfect before and after for that.
We do.
Another issue is masseter, Botox for TMJ, grinding teeth. Do you think it's really worth it?
One, it's going to, visually make you look better because it slims here a little bit, makes the cheekbones pop. The second, it functionally, you'll feel better. It's just, a lot of people feel a lot of tension and stress here. So with Botox, it relaxes that. And it's shown that if you do this for an extended period of time, your temple muscle might compensate. And where you used to get temple hollowing as you get older, your temples may come out a little bit. So Botox masseter for here does 3 great things for your face.
Awesome. Do you wait until filler is fully dissolved to touch it up? Like, is it how it looks or a period of time convo?
10 years ago, we would say come in every 6 months, but now we know that the filler is lasting a long time.
Which is good for your pocketbook.
We usually recommend maybe 9 to 12 month intervals, but we're just using less. And so you may not be looking perfect at 9 months, but you're still gonna look better than you did when I met you. And instead of using 3 syringes, I might just use 1 syringe. So you can come in once a year just to touch it up, but you're going to want to start throwing away some of the filler and maybe just using part of a syringe. And that's.
Are we paying for what you're throwing away?
So actually, sometimes you're paying for someone to throw it away. That's the thing. You want someone who's not going to put the whole syringe in.
Okay. So the question of the day is, why are you so expensive? Because
Okay.
that is everybody's question. They're like, who'd you see? Went to this website, and they're like, wait, what?
Okay, first of all, I mean, you have different ranges of providers, right? So you have your BMWs and you have your other cars, right? So we like to think of ourselves as the BMW of fillers, we like to.
You're not even gonna go for the Lambo?
We could say that, right?
Yeah.
Let's go to Lambo. No, I'd say more BMW because it's not like we're just making up numbers. The one reason that we're more expensive is 2. 1, the amount of filler that it takes to get a good result. So a lot of places you may go and they say, well, can we just get 1 syringe here or 1 syringe here? And we usually recommend patients, hey, you really need to treat this whole area. And it's gonna take 1, 2, 3 the first time. And we know that we're gonna need to see you at least a second time.
And when you come back for that second or third, are you paying for those touch-ups or was that included in your first?
Well, okay, it depends. So sometimes if we've done 3 syringes, you still have a syringe left. And so with the 4th syringe is included in your package.
I got you.
If you need more, then we have like a refinement rate where it's much less.
Okay.
And we'll just keep doing the refinement rate until we both feel like, hey, mission accomplished. The other thing is now that we know that fillers last so long, maybe it took us 5 syringes to get these perfect website amazing results.
Okay.
But then it's going to be like 1 syringe of maintenance once a year for the next 10 years.
So it's really like an upfront. It's the down payment on the BMW, but then your
like that.
maintenance over time.
Exactly.
Yeah. What do you see in the long run for filler users?
When I was doing this 20 years ago, no one was doing fillers, and I had to explain what they were. Like, what are fillers? Now it's almost gone the other way, where we're hearing about overfilling and people using it for the wrong things. So I think we'll see people starting to realize that they're using less fillers, but they're still the best thing for fixing problems like under the eyes or structuring your face. We just need to use less, be more careful with them.
Have like a touch-up kind of approach as opposed to like load you up and see how that goes.
Yeah, exactly. So not using 9 syringes every time, but just using a little bit in 9 months or so. And we'll see that it's going to be just a tiny little maintenance and it's easy to do.
Fantastic. Thank you for answering all these questions. I mean, you
fun.
really
Those are
like
great
went
questions.
into it.
Yeah,
Thank
you
you
got
guys
some
for
really
asking all your
cool.
questions. Love it.